Welcome back to Insight. We're at the health insurance shop here on Lake Avenue, and we're talking to Chris and Chrissy. And if you're 65 or older, you're going to want to know information about this, or you know somebody, love somebody who's 65 plus. Medicare, we're in the open enrollment right now. I'm so naive and sometimes just stupid about these things. I just assumed when I turned 65, everything was taken care of. I'm way off, right?
Yes, you're way off. Not everything is taken care of.
What's not taken care of?
Well, Medicare has deductibles, co-pays, and co-insurances that need to be paid. Those aren't paid by Medicare, and that's the individual's responsibility. Most folks don't want to pay that themselves, so they take insurance to fill that gap.
Okay, that's and so if I come in here, what's the process look like? Where do we start?
Well, we first start with running the analysis of prescriptions.
Okay.
We've got several carriers, and each plan could work best for that person.
Right.
So we just kind of start there, doctors, things like that.
So there's a lot of options that you kind of walk people through, right?
Right. We give all the assistance, and we check the doctors if you're using a network plan. Medicare supplements don't use networks. If they take Medicare, they take your insurance. So a little easier that way, but you pay a premium, where the Advantage plans have low or no premium sometimes, and that's very helpful for a lot of folks.
I was going to ask, who's the person that shouldn't come see you? Does that person exist? I mean, it seems like you're not charging for this service to walk me through and improve my Medicare coverage. Why isn't everyone using this?
We run into that a lot, and it's like a question of, do I need this, or should I have it? And I said, well, maybe you don't need it, but you should have it.
Yeah.
Yes.
Yeah.
Because things change the next day.
Is this, how many times do you see like maybe a younger parent or a younger child, an adult child, bringing in mom or dad who's over 65 to make sure that they get signed up for the right coverage too?
We do have a few of them. Yeah, we do have a few.
And so,
and we like that.
Yes.
We appreciate it when the family gets involved. We like talking to the family, so they're aware of what's going on.
Yeah.
That mom and dad are doing something that's safe.
What's a good day look like for you when somebody comes and talks to you? And you're like, when do you go home feeling really good?
Every day.
Yeah.
I like helping people. I'm sure Chrissy's the same way. It's enjoyable and satisfying. Yes.
And when people buy these insurance plans, they don't have to pay you again to come in and find out and learn, right?
Correct.
Yeah.
We don't charge for the information or our time, so we bring an added benefit that way, and as a value added. So everything is direct with the companies.
Mm-hmm. Do you find, because this open enrollment is only so long, that people come in mad that they didn't take care of this last year, that the date closed, and it's like, wow, I've been waiting, I've this pent up 9-month waiting period until I could come in?
Yeah.
Yeah. And how eager are they? I mean, they're probably already making appointments, and
Yes.
actually they've probably already been in, because the open enrollment started in October 15th?
October 15th, yes.
And goes how long?
Till December 7th.
So don't make December 8th that day you're like, what was I thinking?
And I must say that the Advantage plans and the drug plans have the enrollment period. Medicare supplements, you can change at any time.
Okay, so that's the key, to come in and see you guys, to give you a phone call, and to make sure that they don't have to wait the next 9 months in misery because they didn't do anything here before December 7th, right?
Correct.
All right. We should all be able to remember that date. The Health Insurance Shop, if you want more information, you can go to their webpage, which is buyhealthinsurancehere.com. Come see them on Lake Avenue or give them a call at 484-7010. We'll be right back on Insight.